Hi, everybody. Welcome to this new episode of This Week in Digital Health. My name is Aline Noizet, and I'm your host today. And I've got the pleasure to be with you with Javier Mendoza. Javier is a medical doctor with a passion for new technologies applied to healthcare, and is the first gastroenterologist in the Metaverse. So Javier, welcome. Very excited to have you here today. I'm really looking forward to hearing more about you.
Thank you for this kind invitation. It's a pleasure to talk to you, always. And yeah, I'm a medical doctor, gastroenterology with 20 years of clinical experience. And yeah, since 2017, I did my master in digital health, and I think it's not the future, it's right now, and it's a hype, and it's all passion about this because healthcare is changing right now.
It is. But you know what you're saying just now, you make me think. So there's that sentence we say like the healthcare professionals who are not using AI are gonna stay behind versus those who are using AI. And I'd like to just extrapolate that sentence to making it not just about AI, but about like new technologies in general. What do you think of that?
Yes, this is the last part of a sentence because in many podcasts, in many interviews, they say, do you think that artificial intelligence or robots will replace medical doctors? The answer is no. But after they say, the doctors that use artificial intelligence and all this technology will replace the doctor that don't use. And I would like to go one step more, even in a few years, will be ethics that medical doctors or healthcare professionals don't use all these power tools that is machine learning, artificial intelligence. So there are many information about healthcare, many different treatments now in oncology. So if we have this help that can be technology and artificial intelligence and all these tools, it will be ethics, don't use it. It's a great conversation.
But what do you think we can do to convince like the other healthcare professionals out there who are not using it just yet? Maybe because they're afraid, maybe they don't know how it works. Like, what could we do?
Uh, I saw this map that is very interesting of every country in Europe have a problem to adopt technology. I remember Spain, that is my country, that it's a medical doctor and healthcare professional are a little immobilist. So we have done this every time like this. So we don't want to change. I think we have to change that, but we have to give time to the medical doctor. We have to change medical education. So now there are many examples of UK university, States university that use Microsoft HoloLens for study anatomy or physiology in at medical school, university. I think it's very important. Give time and give tools and explain how technology can help them day by day.
But you mentioned before that you're based here in Spain, just like me. But that I know you spend time in the US, or like, yeah, because of your family, you spend time in Holland. Like, did you see some differences in adoption and application in those different countries when it comes to digital health and new technologies?
Yeah, there's different in technology, in adoption. It's a cultural difference, and it's a difference in healthcare system because Europe is not the same. I have worked 3 years in Portugal, 12 in Spain, and 4 in the Netherlands. So I have this international view, and of course, as you say, my wife family is in the United States. Even my sister is in New York. So I know very well the American system. So every country has a different. I like to explain the way I give bad news when I'm a medical doctor. So it's not only talk about technology. Is I like to talk about these values that healthcare professional can bring there in technology area. So when I give bad news, it's different when I talk to the patient in Portugal, in Spain, or in the Netherlands. Maybe in the Netherlands, it's more direct. Maybe they are more open to technology. Of course, a small country, very with a huge population, but very concentrated. But I think the change is unstoppable. So let's do it.
That's very interesting point that you just mentioned, like the cultural aspect and now the different countries' culture, you have to adapt to that. So I was having the similar discussion with my friend Lisa the other day. So she's a nurse and she spent some time in Vietnam, and she's originally from Wales. Interesting the difference, like over there, like what a patient would expect, how to announce them a news, or maybe tell them like their disease is not good or is good. Do they want to hear it? Maybe some population don't want to hear it. That's very, very interesting. Yes.
Yes, in Spain, there's a very terrible sentence. We say silence conspiration. A lot of families don't want that. No, 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 don't tell my father, don't tell my mother that she or he has a big problem, cancer maybe, or chronic disease. So you have to adapt to that. For me, I'm always say, I love and I believe that technology is changing all this, but I'm not a tech person. And I think that some healthcare professionals have to jump and bring, I said, classic values, empathy, ethics, privacy, special treatment to the data, health data, to technology. So that's why I'm here.
And do you think that like technology can help with empathy, for instance? Do you have some concrete example of that?
Yes. Now with COVID, we all changed to telemedicine, and many patients and many medical doctors are not ready for that. So we have these all classic medical doctors that now have to call or do a video call to a patient. You cannot touch them. So you have to have this empathy. I like to give examples. Medical School of Barcelona had a great course I have done to jump to telemedicine in a better way, because you have to build empathy if you cannot touch and see how the patients can. We will talk after, but I think telemedicine sometimes it's by telephone, and of course it's in 2D and through a screen. In the metaverse will be 3D, and in a room with your medical doctor, you can be in front of them, but you can be around, or you can invite another specialist to the room. I think it's gonna be part of the future.
Exactly. This is super, super exciting. But so before we go to the metaverse, I would like to talk a bit more about like your role as a doctor, being involved in different healthcare startups. That's how we met a few years ago, right? When you're very interested in that space. And I think it's really great because you have those both perspective as a healthcare professional and as a like technologist really interested in that space. And we do need that. So what do you think the role of healthcare professionals, and especially, we talk a lot about doctors, but I think other categories like nurses or paramedics, they also have a role to play in that. So in like helping startups to develop their solutions. What do you think?
I think it's very interesting. I'm gonna say one point that I read in an article that joined with the first question. The nurses will be more difficult to substitute with artificial intelligence or robots than medical doctors. Why? Because they take care. We do more diagnosis that it can be an algorithm. We choose treatment that it can be a protocol, but take care, hold the hand, and listen. It's more difficult. So I'm a medical doctor, but I admire them. So psychologists, we have a real problem of mental health. So we need more specialists. Physiotherapy. It's one part of now of the technology. A lot of apps and projects about that, and nurses. Yeah, it's all will be part of technology. But I like that the nurses will be more difficult to replace because of the way they take care of the patients.
It's also very interesting that you mentioned psychologists, because a few weeks ago I was in a conference in south of France, and my friend Christophe Joquet was there doing a presentation on digital humans and how they will play a role in healthcare in the future. And he was giving examples of digital humans that will actually, like, kind of robots or avatars that are helping patients with their mental health. So they can be on their phone and you just can talk to them on a regular basis. And like they remember what you tell them, you'll talk to them a week after and say, hey, so how is it going? Like, is it better with your boyfriend now? I know that was worrying you last week. I think it was very interesting discussion, see how this will evolve.
Yeah, but I have read articles about that. And when they ask patients, what do you prefer to talk to chatbot or to a psychologist or by phone or video call? Most of the patient choose chatbots. There's no judgment. There's no I don't know, a bad relationship. There's not, and they prefer chatbot. For me, it's a surprise, but they're having this feedback. So we have to think about that. But the need to change mental health, I think I have read, and it's totally true, is an epidemics inside the pandemics. People have been locked out. People have been without talk to or touch people that they love, or the need of the help of the healthcare professional. And now we have a big problem. And of course, the social media for teenagers. Huh?
Oh, exactly. Yeah, this is another one coming as well. Okay, so Javier, now I would like to come to the exciting part of the discussion. Let's talk about the metaverse. So first, I know that many people are still not too clear what it is. So can you tell us what is the metaverse?
Yeah, I like there are the sense of definitions, but I like to go simple. Metaverse is a concept, and it's a concept that is building right now between evangelists, people that think that it can be useful, and in classic sectors like education or healthcare, that is my case. But skeptics are included because with that, we build a better concept of metaverse. But go to the definition. For me, is a concept of immersive world between digital and physical, with some characteristics that have to be in. So immersive, of course, but persistent, will not stop, not on off. Decentralized. Many people talk about that. What's the meaning? That the users will own and the owner will be distributed. Social, of course. Interoperability. It's a wall that is very related with medicine. We can jump. So maybe we'll be a metaverse, but multiverse, or NVIDIA have omniverse. We can jump from one place to another. So that's the concept that we are building. But this, it's a game changer.
And what are the opportunities for healthcare?
There are many right now, and it's building. People say, no, this is for, in 2, 3, 4 years, but this is nothing. So 2025 is here. So right now, okay, some bullets. Mental health, of course, is a treating of phobias, stress disorders, eating disorders. It's important. Another one, pain. The way you treat pain with virtual reality is used now instead of CNA by gastroenterology in IBS, irritable bowel syndrome. Another ballet, rehabilitation. So you put your virtual reality glasses and you use this. It's not only virtual reality. For example, the patient journey that many articles talk about that. Exploro, it's a great project with augmented reality. So you see, now it's specific for children. I hope that soon will be for adults also. But you see where to go to do the MRI. In an augmented reality, you see what is a MRI. You can play a game, so it's a gamification inside this many projects, and of course medical image, right? Radiology 3D. It's you have tomorrow a very difficult surgery, and the day before the surgeon can training for that surgery with a 3D image, or even in the operation room. So it's many things that's going on. And as I said, teleconsultation. Maybe we are not ready right now, but it's the matter of change a name, second opinion. You can sit down and have a second opinion. Hey, listen, I'm a medical doctor in Spanish. The immediate translation will arrive, but right now I can sit down with a man from Bogota and he say, hey, listen, they told me that no, here we do different, but I can explain to you what is a colonoscopy with a polypectomy and the risk, and it can be a consultation in the metaverse.
That sounds very exciting. So it means like you just consult a doctor from anywhere, right? There's no more like geographical limits.
Exactly. Exactly. It's one part. Decentralized is now the wall is there, and you don't pay. So Colombia, you pay with dollars, with euro. You buy tokens, healthcare tokens. Now, if you go to coin market, it's many crypto, many tokens. I think there are 19, 20 healthcare tokens. So all the tokens to buy healthcare utilities and healthcare works. It's amazing.
So that gets us to like NFTs, right?
NFT can be different. NFT, that there are some projects. Well, for me, Metaverse and Web3 will be over a blockchain. That will be the structure, and the NFT can help. For example, the other day I saw this great project that talk, not NFT, dynamic NFT. It's an NFT that is changing with your healthcare data. So if you, I have a problem, they did ultrasound, abdominal ultrasound, you put in your NFT that is your health data, and you can move. It's many projects that is amazing.
That sounds, yeah, very, very exciting. I think the futures are bright. So maybe coming back to you. So we mentioned at the beginning, so your title is the first gastroenterologist in the metaverse. Can you tell us more about that?
Well, yeah, this is the title, and some people wrote to me, I want to see you as a gastroenterology and metaverse. I say, well, right now it's a concept. It's not right now. I'm medical advisor of a company. It's the first company that is doing this hospital in the metaverse called iMedis. And I chose that company because 2 points. One, the two co-founders are medical doctors. So I believe that they are focusing take good care of the patients and their health data. And the second, the company is in the Netherlands. So they follow the GDPR, so all these legal process and the privacy and a good treatment of the health data. So with that, I became the first gastroenterology in the metaverse. That if you Google it, is there, but it's a concept, and there's many things, as I said, that now we can do in the metaverse. So very soon we will start to do things, and this company has agreements with pharma companies, with academia, Hospital University of Tokyo, Lausanne in Switzerland. So yeah, it's growing. It's not the only one. There's some companies that are doing the same, healthcare and metaverse. And yeah, this is huge. It's not only one company. We are building that.
But is it already working at the moment? Can you tell us a bit more about that, like medical city that they are building, like Avalon, as they call it?
Avalon is building right now. It's not working right now, but there's they're building in some way. Like I know that with some pharma companies. No, I prefer to be there, so they rent or buy some room in that hospital, and from there they can do meetings, or they can invite doctors to present the new pharma that they have. Or so every company, every university, they're trying to do new things. It's not working right now, but it will be soon, and it's growing with, as I say, NFT tokens, treatment of the health data, and we will do medical consultations also.
Fantastic. And like following up on that, like how can you actually auscult a patient in the metaverse? Because you can't really touch the people, can you?
Exactly. Well, right now you cannot touch, but there are some projects of, I don't know if you know about Aptics company. There's some, even some Spanish, OWO. So it's a suit that you put and you feel, you can feel pain, you can feel hot, you can feel cold. There's another one company in England, Tesla suits, and you can put your gloves and you feel. So in a few years, maybe right now, not, but I say the consultation can be second opinion. Or when they told me something, gastroenterology, some emergency, I have blood in my tools, you can have, my first advice, you have to go to right now to a hospital. So we cannot lose, as I say, the classic values in the metaverse, or using technology that is, as I say, ethics, empathy, look at the patients, be close to them and listen to them.
And I understand that one specificity of the metaverse is that you can get in as an avatar. You can choose the look when you go in there. So like if I'm a patient and I go and see you and you're wearing your avatar, how do I know that it's you? And how do you know that it's me under my avatar? Like, I think there's some security questions maybe behind that.
Security, of course, but there's this project that is, there are many things, so we can talk hours about that. But with that, it's the solution is the self-sovereign identity. So there are companies that are working about that. So you will be your avatar that, but they can be sure that you are the person that you say. So they're building the SSI, so self-sovereign identity, and you can be identified as a medical doctor with when I'm working on that. But that's important. You ask for a very important thing in the metaverse, and there are people that are focusing that. The other day I talked with one guy here in Seville that is focused not in the metaverse, avatars in the metaverse. Blow my mind. I say, yeah, it can be pixel, it can be realistic, it can be hyper realistic. So it can be me, like a video 3D of me. But the identity, it's very important in the metaverse. Yes.
Well, like Shafi Ahmed, he has his own avatar, right? Like really the copy of him. It's very cute.
Exactly. Is an example of a chief metaverse officer. There are some and more companies here in Spain. We can say Telefonica have a chief metaverse officer that is a woman called Yaiza. That's nice. The other day, for example, they invite me to talk in a conference I say, you can be the moderator. Okay, show me the panel. 4 months and me. And say, 5 men talking about metaverse. I think we have to be more inclusive. I say, yeah, maybe we change. I say, yes, that's not the whole reality. At least 50-50, or at least one woman.
No, but there are some great experts out there, like women experts like Cecilia here in Barcelona. She even opened recently a NFT shop, and yeah, great expert around metaverse. So there's definitely some women out there. Yeah, I agree with you.
Kathy Hawk is another example. The other day she was in the Nasdaq, so with all the stocks, metaverse is growing. But I think have the woman point of view. It's important. It cannot be only, and that's one bias that always say with artificial intelligence, talking about another technology, that the algorithms are made for white male from 25 until 45. So that's not the reality of the world.
Exactly. Well, Javier, that's, I think very exciting part. It's all about the metaverse. And now, as a conclusion, wrapping up question, I would like to hear from you, like, what technologies you're most excited about, like when it comes to healthcare, like to the mid-long term.
I was waiting for this question, and I didn't want to say before, but one thing that is going to change many things is digital twin. Digital twin is not a hype; it's a reality in other sectors like aeronautics and in healthcare. So many years, and you are in digital health. We all talk the 4 or 5P: predictive, populational, preventive, personalized medicine. At last, we have personalized medicine with digital twin. So it's a representation of ourselves in the digital world, in the metaverse. So you can choose with all your information, clinical information, radiology, genomics, microbiome. Okay, you need the treatment, and now there's many lines for this treatment. No, the first treatment, maybe the patients can have a kidney problem. The second line, maybe infection. The third line is the perfect in your digital twin. So you will, they will give you the third line, or preparing surgery or clinical trials. So if you ask, the answer to your question is digital twin is going to change, and at last we're going to have a personalized medicine in 21st century.
That's awesome. Well, Javier, thank you so much. It was really a pleasure to have you here. It's always a pleasure to discuss innovation with you. And we'll share all your information on the website so people can follow you and keep up to date with all the exciting things that you're doing. And they can follow the first gastroenterologist in the metaverse. Speak to you soon.
Thank you
have
for
a
your
great
invitation.
day. Bye.
Bye-bye.